This is a Clinical Journal of American Society of Nephrology podcast, and I am Reza Malekzadeh from Tehran University of Medical Science, Iran. I am privileged to have the opportunity for collaborating with Professor Salim Youssef team on this individual participant data meta-analysis, which is done on data pulled from 3 randomized controlled trials that evaluated the effectiveness of fixed-dose combination therapy, or so-called polypill, versus control. The control were either placebo or minimal care for primary and or secondary prevention of the cardiovascular disease. The polypill contained 2 hypertension-lowering agents and 1 statin with or without aspirin. The first trial, Poly-Iran, was nested within the Golestan cohort study, which was the first large cohort study in Middle East. We recruited 6,838 participants between February 22, 2011 and April 15, 2013 in 2 arms. Polypill arm containing aspirin and minimal care. We followed participants for at least 5 years with less than 1% loss to follow-up. The other 2 trials, HOPE-3 and TIP-3, recruited participants in several countries and had factorial design and included polypill arm with or without aspirin. The individual level data from the entire study population in these 3 trials have previously been pooled, and the results showed that the fixed-dose combination therapy was effective, safe, and affordable treatment for primary and secondary prevention of cardiovascular disease among apparently healthy individuals older than 50. This study also revealed that polypill with aspirin was safe and more effective than polypill without aspirin. In this new study published in Clinical Journal of American Society of Nephrology, we performed an additional individual participant data meta-analysis to evaluate whether polypill was also effective and safe among individuals older than 50 with impaired kidney function based on the level of their creatinine and with high risk of cardiovascular event. We performed subgroup analysis and found that polypill is even more effective for primary prevention of cardiovascular disease among participants with low kidney function, and the differential effect was significant. The side effect did not differ between participants and healthy kidney function and those participants with low kidney function. It is important to mention that polypill was recently added to the list of cardiovascular disease essential medicine in the esteemed 2023 WHO model list of essential medicine. I want to close by thanking the editorial board of the Clinical Journal of the American Society of Nephrology for considering, reviewing, and accepting this study for publication.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.